Hi, I'd like to talk to you about our policy at Hope Mental Health about benzodiazepines. This is a very serious topic, obviously. Benzodiazepines are controlled substances that are sometimes used for short-term symptoms such as fear of flying and other traumatic events. They can be quite effective for rare occurrences, and we don't recommend you use them for more than a 2-week period. If you continue to take them long-term, however, there is a downside to these meds. In the long run, patients typically experience a tolerance that leads to a worsening of symptoms, including increased anxiety, possibly anger, irritability, and insomnia. More and more research is also showing that this class of meds in the long run may cause poor focus and concentration, clumsiness, and even dementia and Alzheimer's disease down the road. Sometimes some physical symptoms become prevalent, such as poor appetite, nausea, vomiting, and diarrhea. As our focus is on good mental health at Hope Mental Health, we rarely prescribe these medications. But if you are currently on a very high level of these meds, we would recommend you go to your GP and have him taper yourself down to a manageable level, perhaps to a couple times a week, and then we can take over from there. Please understand, we will never discontinue your meds cold turkey. Everyone is unique, and we have a lot of compassion for people going through this process and other mental health problems. We will typically add other meds to aid in the coming down process and begin to correct the underlying psychiatric disorder. The process can take weeks to months. I recommend that you come in for very regular support during this time. Hopefully you will also be doing therapy, which will be very helpful in developing other coping mechanisms to deal with your symptoms along with the meds. Keep in mind there are great alternatives to benzodiazepines, and we'd love to help you here at Hope Mental Health.